Greetings, Zimbabwe. Welcome to Zimbabwe Daily. My name is Patience Titsimashire, and we are here live on our program Behind the Mic. And today we'll be talking to Caroline Mutimbanyoka, who is the team leader for the Muda Dam movement. And I think she'll elaborate more about it. Thank you so much, Carol, for joining us. And please introduce yourself to the community. So to those who have just joined us today, we'll be talking to Caroline Mutimbanyoka, who is the team leader for the Muda Dam movement, and a movement which is advocating for the construction of a dam in Chitungwiza to make sure that Chitungwiza has its own source of water. As you all know, that Chitungwiza relies on water to get water from Harare, and with the cholera cases continue to accelerate because there is no water in Chitungwiza. We talk of sewer burst, we talk of a lot of things that are happening in Chitungwiza. So Caroline, can you hear me? So maybe I'll be, as we wait for Caroline, I'll give you an update on the cases of cholera in Chitungwiza. As of Saturday, the numbers were at 53 cases of cholera, and I think by now we still have more cases. And in St. Mary's, that's where you get at St. Mary's Clinic. That's where you get when you have cholera, you go there. That's where they are making sure that everyone who has cholera is being treated. So, Caroline, can you hear me?
Yes, I can hear you, Titi. Good afternoon.
Yeah, so thank you so much for joining us. You can introduce yourself and tell us who you are and why are you here today.
My name is Caroline Mutimbanyoka. I am a community development practitioner. I work with women empowerment, but today I'm here around the issue of the Buddha Dam initiative that we've been pushing since the time of COVID. With the cholera cases that are on the rise, I think our plight for access to water becomes more critical in this space where it's a matter of also saving lives, but ensuring that people are able to access clean, safe, and potable water and aligning that, to the Constitution of Zimbabwe on Section 77, which speaks to, their rights to access clean water. So, we are here to speak about the current cholera crisis and how that is affecting the community and the agency that is needed in people of Chitungwiza accessing water.
Mm-hmm. Carol, maybe to take you back a little bit, how is the response
Right.
in terms of, as you are advocating for the construction of a dam, how is the response from the local governance and also from the government of Zimbabwe?
So, Titi, we have been trying, and I know at some point in 2021, we wrote to Treasury and we asked them because we got information from council. At first, we thought it was the responsibility of the local council to ensure that we have access to water. But through our engagement with them, we were told that this is now a government initiative. So we wrote to Treasury and we asked them to help us as they will be doing their budget allocations to ensure that there's an allocation towards Muda Dam. So they responded, but the issue was then discussed with the council. And with the current changes in terms of leadership around Chitungwiza, it's always difficult to get information from one leadership group of leadership to the next. And also now, as we are going towards budget, this is the time that we expect also feedback from government or to at least hear the people or what the citizens are saying on the ground to ensure that our needs are then prioritized as they do budget allocations. So
Mm-hmm.
yes, they are talking about it, but really there is really nothing that we are seeing or that is concrete that is saying we are doing feasibility studies and we will be done by this time. So it makes it difficult because there are no timelines. We know they want to do it, they are going to do it, but lack of timelines then makes it difficult for us to, try and get them to give us feedback or to just, talk about accountability along those lines. So this is the delay that we are facing. But right now, the challenges they keep on, getting more and more. We were just in COVID, and now we're in cholera. What is next?
Mhm.
And
Maybe let's talk about your work in the community as you work with
right.
different women and different from the whole of Chitungwiza and all the 25 wards. What are the challenges the women are facing in terms of accessing water?
So the issue around access to water it is very complex. The first thing is, as a woman, you're expected to be the one who's taking care of the household. So that means you're the one who looks for water, you're the one who do the washing, you're also the one who is ensuring that the place where you're staying or the environment is clean. So that
Mhm.
on its own puts us at risk and of diseases like cholera because we are the ones who are caring for the people who are sick. We are the ones who are washing. Even during COVID, it's exposing women more to open spaces where they have to go to bowls that are manual and they have to look for water. So you find that we have serious issues around even the issue of unpaid care work, the time that women are spending to actually go and look for water and come back. And when we are in these spaces, these are public spaces. There are people who control those spaces, and there's a lot of violence. And if those people are not aware of the gender dynamics, we also face such issues, and people are not gender responsive around that. So you find that we also face challenges where we have the elderly or women who are pregnant or a child or a girl child who has to quickly go to school, spending so much time trying to access water instead of, going to school in this case. So you find that there are many, many challenges that comes with, the water crisis that we are facing in Chitungwiza right now. We have
Mhm.
seen cases of harassment. We have seen violence emanating at water points. And at some point, we had someone who actually died as a result of violence at the water point. So these are some of the issues that are emanating from that. You will also see increased cases of violence even in the homes because now we have women going, spending so much time at the water points, but the husbands are unsure. There is also blame that you're going, you're spending time or you're not at the water point, you have gone to other places, which, touches on the social ills or the social issues that emanate from just not having water. So this is a
Mhm.
crisis that I think is very serious and should be spoken about.
Mhm.
Yes.
So like you mentioned that this is a crisis. What is your message to the government of Zimbabwe?
So Titi, I think as we are going towards the issue of budget allocations, the issue of budget consultations becomes very critical. We want our government to come back to us and hear what our needs as the citizens. If you look at it now, we have spaces in Chitungwiza or other areas like Yozengeza 5 after Limbani, Ward 6, that area, they've gone for years without access to water. So when cholera comes, when COVID comes, when some of these health hazards are coming, it means that we are continuously putting those people at risk of death and we can't like rule it out. So
Mhm.
our plea is that as they are doing budget allocations, they prioritize a permanent water source for the people of Chitungwiza. If you look at our population, it continues to increase, but the resources are getting fewer and fewer. And that is what is prompting people to go and look for water or to drill boreholes on their own, and then they put them on top of sewer pipes. And we have a crisis around that. And the health issues that emanates from that are severe. So we would want our government to really look into the issue of Chitungwiza and ensure that Chitungwiza have its own water source so that it can service its ever-growing population, but also be able to service even other areas that are nearer. Because right now, relying with Harare, when Harare itself does not have enough water for its citizens, it is really difficult. So we want them to really look into that and ensure that Chitungwiza has its own water source.
Mhm. And then what's your message to
Tsitsi, I'm losing you in terms of your volume.
Okay, sorry. So I was saying, yesterday as we were moving around, we met a woman who benefited one of the menstrual cups. If you remember the menstrual cups that the Muda Game Dam initiative gave out to the women in Chitungwiza. So she was saying because of the challenges of accessing water, the cups are helpful, but still we need clean water, clean and potable water to make sure that we continue to do the hygiene towards menstrual health. So what's your message to the women out there in Chitungwiza?
You know what, Titi, we can try as much as we can to the women. My message for them would be try to, access water from those clean sources, from the bores that are drilled. But now even the bores themselves are getting dry, meaning
Mhm,
that the message that we have to push is around Chitungiza having its own water source. And that
mhm,
is a message that we have, that we are convinced that if that is done, we eliminate the water crisis that women are facing in Chitungwiza. In as much
mhm,
as we may try to bring in cabs, it's yes, of course, to reduce the burden, but what it does is it does not fix the permanent challenge that we are facing, that of not having water. Titi, you can imagine when you are a woman and you have your periods, you need water to clean the house. You also need
mhm,
water to clean yourself. You are buying water to flush the toilet. You are buying water to brush your teeth. That
mhm,
on its own is a challenge, and I feel that it's a challenge that cannot be fixed by the women themselves. But we look up to our government, because if we say we want, we are leaving no one behind, the women in this case are being left behind, and the solution that we have to that is to ensure that there is a permanent water source in Chitungwiza. And this plight that we have is not a plight for individuals. It's a
mhm,
collective plea that we have, and all women and everyone should join hands so that we ask from our government, because through our taxes we are contributing, and would want the taxes or the money that we are paying through taxes to speak to our needs. That is all that we are asking for. The money that we are paying towards taxes should be used to come and ensure that we have our own water source in Chitungwiza.
mhm,
So this is my
mhm,
message to everyone, that they should be part of the movement, because the movement is literally speaking about access to water. And
mhm,
accessing water will not only help in the households, it will also, reduce the amount of poverty, the water poverty that we are seeing wearing the face of a woman in this case. So we are really
mhm,
asking for people who are in the community, our women, to know that Muda Dam initiative exists, and this can only be done by our efforts, or to ask the powers that be, the leadership, the government that we put in place, to see that challenge and to address it through the taxes that we are paying.
mhm. Thank you so much, Carol. Do you have any last words?
The last word, Titi, would be for us to do as much as we can to look out for cholera, but to also call on council to ensure that they also fix the sewer pipes, they also do refuse collection, because those things work hand in hand. We cannot isolate one and deal with the other. It means we have to look into effective social service delivery to ensure that we eliminate or we curb as many victims as possible from the cholera pandemic.
Hmm. Thank you so much for joining us today, Carol. We are really grateful.
Thank you so much, Titi. Have a lovely day.
Okay. Thank you so much, our viewers and listeners, for following through this program today, right here on Zimbabwe Daily, as we were talking about the water challenges in Chitungwiza, where a group of women are fighting or are advocating for the Muda Dam to be built so that people in Chitungwiza would have their own access to clean and potable water. So, yes, of course, as you all know, that there is a cholera outbreak throughout the country in about 41 districts in all the 10 provinces in Zimbabwe. So, make sure that you keep yourself safe, wash your hands, eat hot food, make sure that you are hygienic in everything that you do. Until we meet again, it's goodbye for now.